All right, good afternoon. My name is Tony Delaney. I'm the clinical case manager with the Office of Student Support at the University of Baltimore. And today we have guests from the Jacques Initiative, and they're going to present to us on HIV prevention and have a chat with some various information. Before we started, I did want to go around the room and allow everyone to introduce themselves. And so I guess we'll start with Rhonda.
Hi, everyone. My name is Rhonda Carr. I am an employee of Jacques Initiative. I am a community outreach worker. Oh, and my pronouns are she, her. Sorry.
And oh my goodness, forgive me, I forgot my pronouns are he, him, and his. And Sierra?
Yes, hello everyone. My name is Sierra Carey Brown. I am also with the Jacques Initiative, and my pronouns are she, her.
And Jarrell? Oh, you're muted.
You just muted back again.
I saw. My name is Jarrell Smith. I'm also with the Jacques Initiative. I'm a community health worker, and my pronouns are he and him.
Last but not least, my colleague, Megan Humphreys.
Hi, I'm Megan Humphreys. I am the Student Conduct Case Manager within the Office of Student Support at University of Baltimore, and I use she, her pronouns.
Well, thank you so much for everyone who's joining us in person today and everyone who's joining us at home or maybe watching this recording later. And I'm going to turn it over to Sierra and take it away.
Yes, hello everyone. Let me just share my screen here. All right, how was that? How was that looking?
It's the presenter view.
Okay. Okay, thank you. So you can't see the notes, correct?
I can see the notes. Add notes to your design on the side.
How did that happen? Everything's to be...
Cool, we're good.
Okay, finally, thank you. Yes, and thank you for coming in, everyone. This is the HIV prevention chat. We did briefly give our introduction already. Again, my name is Sierra. I'm here with Rhonda and Jarrell. We are the Jacques Initiative, and we represent the Jacques' outreach team. Just a little bit about the Jacques Initiative. The Jacques Initiative is an HIV prevention program at University of Maryland, Baltimore. Also, just a quick note, during this presentation, if you have any questions, please don't be afraid to raise your hand or type a question in the chat, and we'll try to answer them as soon as possible. Thank you for spending your afternoon with us. And so the topics of the hour that we will be discussing are HIV 101. So the what, the how of HIV. We're going to talk about HIV prevention, all the different methods to prevent from getting HIV, from contracting HIV, and then we're going to address all the stigmas and the myths that are out there. There are a lot, and we hear about them almost daily. Yes, so what is HIV? Rhonda?
Hello, everyone. It's me, Rhonda, again. So I'm going to give you two different ways of saying it. I'm going to give you the book version, and I'm going to give you in layman's terms. What is HIV? HIV stands for Human Immunodeficiency Virus. It is the virus that can lead to acquired immunodeficiency syndrome, or AIDS. Being HIV positive doesn't necessarily mean you have AIDS. So HIV is the virus that can lead to the disease AIDS. The difference between HIV and AIDS is basically your viral load and your CD4 count. You want your viral load to be suppressed. You want that to be low. You want your CD4 count to be high. What is a CD4 count? A CD4 count is how many white blood cells that you have that can fight off any type of infections that you have in your body. When you're AIDS defined, if your CD4 count would have to be 200 or lower. Anybody who has a CD4 count of above 200 will be HIV, and anyone that acquires their CD4 count to be under 200 will be AIDS acquired. Now, if in fact that you're AIDS, if you meet 200 or lower and you take your medication and you get back up to, let's say, 500 CD4 count, you would still be AIDS acquired, you'd be AIDS defined. Reason being is that once you reach AIDS defined, it's just a way of figuring out for scientists who has reached this number, who has not reached this number. So you can be still AIDS defined and your CD4 count could be over 200. Just a little keynote.
Also, I would like to add that there are symptoms sometimes when someone contracts the HIV virus, and they are flu-like, and they tend to be very mild. So it's milder than the flu. And that can include the sniffling, the vomiting, the diarrhea. But of course, especially in these times, a lot of that not only sounds like the flu, it might sound like or feel like food poisoning. COVID is going on right now. There are seasonal allergies going on right now. So a lot of the time, if someone has HIV, it could seem like a quick cold. So we want to always make sure and stress, please, that you do get regular HIV testing. Gerald?
Okay, so this slide is basically how HIV is transmitted, and it's usually transmitted with bodily fluids, meaning blood, semen, breast milk, vaginal fluid, or rectal fluid.
Yes, and I also want to add here for breast milk, for women who are pregnant, for women who are nursing, if in fact that they just recently find out that they are HIV positive and they have not been able to take medication as long as someone who found out maybe years ago, doctors can prescribe medication for the mom so that the baby does not contract the virus. Additionally, what does happen is sometimes they do prescribe medication for the infant. It's very, very successful. A lot of women are having children, and the moms are HIV positive and their children are not. Right, so this is HIV in Baltimore. What are the statistics? The statistics I have are updated. It has been updated up to June 30th, 2020, but we must keep in mind, of course, you know, the world was shocked with COVID in March of 2020, and that affected a lot of things. A lot of businesses were shut down, a lot of clinics were affected, a lot of people lost their jobs. And so the numbers that we have currently, a lot of statistics that we have currently by HIV might not be accurate, okay? So around Maryland, Baltimore is one city in Maryland, one small city in Maryland. However, Baltimore City accounts for 52.7% of all of Maryland's HIV diagnoses. Now, who is affected? Mostly 59.2% of new HIV diagnoses are from those who are ages 20 to 39. Now, really think about those numbers. 20 to 39, those are college aged, Those are people who you're over 18, you're just going out, you're getting to date, you're getting to know people. Not many, I'm not going to say most, but not many people are settling into monogamous relationships at this time. So this is a critical age where we're finding that a lot of people are being newly diagnosed with HIV. And we have found, aligned with national statistics, of course, that of the people who are positive for HIV, only 10% of them have not been diagnosed, either because they are not aware. Well, really, it's because they are not aware because they have not been tested. Next, here for HIV in Baltimore, we are seeing the top 3 exposure risks for contracting HIV. Now, for example, you see here, it says that 3.4 out of 10. So 3.4 out of 10 times, someone who has contracted HIV is from male to male sexual contact. For heterosexual contact, it is 3.5 out of 10. For injection drug users, it is 2.3 out of 10. However, what I want to say here, what is really important, is that we not focus on the type of person, we want to focus on the activity. So it is not necessarily male to male contact, it is and we will get into this later, we did mention it before, but it is the anal sex that is risky. It's not necessarily the person that is quote unquote risky. And now we will move into HIV prevention and the plethora of ways that we can prevent. This is all preventable, okay? We are not in 1980. We know a lot about the virus. We know a lot about how it is contracted. Okay, Rhonda, please.
Okay, so we're going to talk about PrEP first. PrEP, what is PrEP? PrEP is a medication that has been designed for people who are at high risk. High risk meaning that you're having multiple sex partners, that you're in a relationship with someone who's HIV positive, who is not undetectable. Undetectable, I'm going to touch on that just a little bit. Undetectable means that you have been taking your medication for at least 3 months as prescribed. And what undetectable basically means is that when you do a blood test, that your HIV cannot be traced in a blood test, which means that you can no longer pass on the virus sexually. So if you're involved with someone who is HIV positive and they are not taking medications, PrEP would be a great thing for you. PrEP is also for people who are not in a monogamous relationship. You can be monogamous, but your partner may not be monogamous. So you would take this medication to protect yourself. PrEP is not something that you would take for a lifetime. It's for bits and pieces and parts of your life. Because we all have those times in our lives when we like to go out, have a great time, live out, be a hot girl summer, hot boy summer, whatever it is. And we want to get your groove back like Stella. And sometimes, people don't use the best, precautions. You may not have a condom, whatever the case may be. Whatever the situation is, we're not judging here because we're always sex positive. However we want to have it, we just make it work for you. So PrEP is for those people who are at high risk, that are responsible enough to take care of themselves and make sure they get on this medication. Now, the way this medication is 2 medications that you could use if you are a male or transgendered person who has anal sex, then they would provide you on either Descovy or Truvada. If you are a cisgender female, meaning that you were born female and you are still a female, then they will basically only give you one option, which is Truvada. The reason being is because we haven't had many females to do the study on Descovy, so they don't have any records or any data to show if it works or how it works for cisgender women. Now, for males or anyone who's having anal sex, you would take PrEP for 7 to 10 days consecutively as prescribed every day for it to work, which means that you would take this medication at least 7 days for it to actively work. For cisgender women who are having vaginal sex, or anyone who's having vaginal sex, let me quote that because I don't want to get mixed up on, pronouns and misgendering people and things like that. So if you're having vaginal sex, it would take at least to 28 days of taking this medication for it to actively work. So remember those key days. So you have 7 days if you're having anal sex, at least 7 days. And if you're having vaginal sex, let's say 28 days of taking this medication consecutively for it to actively work. How does PrEP work? Well, we all know that HIV, it goes into your body, it attacks your DNA and turns your DNA to RNA. The way that your DNA pushes out or produces white blood cells to fight off any type of infection is the same that HIV do when they change your DNA to RNA. Now, PrEP, what it does is, in layman's terms, it goes into your body, it coats your DNA. So therefore, if you do come in contact with someone who's HIV positive, it doesn't have a host. The HIV doesn't have a host to clamp onto. So basically the HIV would just bounce off and it would just basically magically go away. I'm going to say magically go away because it has nothing to attach itself to. So you won't be infected. And with that being said, that you could have a best hot girl summer, a best hot boy summer, however you want to have your way and not worry about HIV. But PrEP does not prevent other STIs such as syphilis, gonorrhea, chlamydia, trichomonas, any of those things it does not prevent. So you still have to be technically a little safe with your hot girl or hot boy summer because the summer is coming. So that's a little bit about PrEP.
You did share a little bit of this. Oh, also, I do want to add, Rhonda, and thank you, needle sharing. So for sexual activity, PrEP prevents HIV up to 99%. However, if you are needle sharing, PrEP prevents you from getting HIV up to 72%. So it's not as effective for sexual activity. However, 72% is a very good amount.
So I gave you what it was to talk about PrEP. So let's talk about PEP. PEP is basically PrEP sisters, how I say it. I'm from the community, so I have a little fun way or different type of way of educating the people that I service. So how I always give you what PEP is. PEP is basically PrEP sister. PrEP is pre-exposure prophylactic, which means you would take it before having sex. PEP is something that you can take after you've been in contact with someone that's HIV positive, or for most cases, sexual assault cases where you don't know the person's status, or if in fact, because I do notice this happens with people, people play the condom games, they may slip the condom off, whatever the case may be, they play all type of games. So what PEP is PrEP sister. You don't have to take it for as long as you would take PrEP, but what it does is, you have 72 hours to you to get to your local ED. Then they will prescribe you onto what PEP is. PEP is basically a regimen of medication. It's not just one medication, it's a regimen of medication. It may be 2 pills. Most likely 9 times out of 10, it's 2 pills that you will take. And you'll take it for 28 days. The reason being, when you're taking PEP, why it's very important to see a doctor within the 72-hour period. You have a grace period of 72 hours. Before HIV can really clamp onto something. So you have that 72-hour window period, very important. They would then prescribe you, they'll give you a HIV test, make sure that you're negative. Then they will prescribe you onto PEP. PEP is something, like I said, you'll take it for 28 days. How does it work? The same way that PrEP was. It coats you, make sure it goes over top of your DNA so that HIV won't have a host to clamp onto. You'll take this for 28 days. After the 28 days, then you can get an HIV test to show that the medication did work. I work with PEP a lot of times with the ED. We have a partnership with Mercy and University of Maryland as well. I usually get emails with sexual assault patients. I then call them, I give them who I am, what PEP is, how PEP works, and how important PEP is. PEP is very important that you take it every day for 28 days without missing any dosages. Any dosages missed is an open opportunity for your HIV to clamp onto your DNA to turn your DNA to RNA. So it's very important that you make sure that you take this medication without missing any dosages, okay? And this medication could be for anybody, male, female, non-binary, transgender, anyone. It's not just for LGBTQ people, it's for anybody who may have been exposed to HIV. U equals U.
Yes,
So
this is what Rhoda was speaking about earlier. This is the motto, okay? U equals U. Undetectable equals untransmissible. I'm sorry, Rhonda, go ahead.
So if you are HIV positive, it is not a death sentence like it used to be. Medicine has came so far. It has made some great changes. So it makes my work and my coworkers' work so much more better and easier for us to tell someone that they're HIV positive, because medication is working so greatly and for people who are HIV positive. Now, what does U equals U mean? Like she said, it's undetectable, meaning that you're untransmittable. Why is that a great thing? Okay, so if you catch your HIV, someone gives you an HIV test and it becomes positive, I would say they will prescribe you one. They do a genome test. They'll basically, I'm going to break it down in layman's terms because a genome test you may not understand. They'll do a blood test to make sure that you're HIV positive. Once they make sure that you're HIV positive, it's also a test to find out what medications would work best for you, because every medication is not good for everybody. So with science, they have multiple antiviral medications that can help you out, that will fit your lifestyle. Some people may not be able to take a medication the same time every day. Some people need a little bit more leniency with taking their medication. Some people will take 3 pills a day. Some people may take 1 pill a day. Some people may take 2 pills a day, regardless of how many pills or what your regimen is. If you're taking the medication as prescribed, which will mean that, let's say after 3 months of taking your medication as prescribed, you will be undetectable, which means that you will not be able to pass on the virus sexually. Yes, you heard it from me first. You will not be able to pass on the virus sexually, which means you can have a happy, healthy sex life. You can still have kids. You can still get married. You can still be in a healthy relationship. Nothing has to change about life. It's just that you have to take your medication that's prescribed. And it's the older you get, honey, I tell you, you take all types of pills, vitamin C, vitamin D, vitamin E, just add it to your regimen and you'll be fine.
Okay. So thank you for that, Rhonda.
You're welcome.
She broke down the biopharmaceutical methods, basically the medication that is used to prevent HIV, both before sexual contact and after sexual contact. But now we're going to get into the good old barrier protection. These never go out of style. Okay, Jarrell.
Okay, so we have the internal condoms, the external condoms, the finger condoms, and the dental dams. Internal condoms are used when you're having sex and you want to put them inside of you, and they'll protect you that way from getting HIV. The external condoms are usually placed on penises, and you'll use them that way and you won't contract HIV that way. Finger condoms we use when you're having digital sex, basically, and you'll put them on your fingers and it won't transfer any diseases as well as any bacteria that you get on your fingers. Dental dams are basically you use for oral sex, and you place them over your mouth or over the mouth or the penis or the butt, and you'll use all of that, and you won't pass any germs or bacteria that way as well.
Right. And so I want to clarify for the internal condoms, because what we are used to calling them are female condoms. We cannot use female condoms. Why can't we use female condoms? Because not only females use them. Cisgender women do use internal condoms. They insert them into the vagina. However, transgender men may decide to use internal condoms to insert into their vagina. However, or additionally, cisgender men, anyone basically can use an internal condom rectally. And I must say this, what I have on my finger here is a finger condom. A lot of people see these and they're like, what in the world is this? This can't possibly fit on anyone, but it can fit on everyone. This is a finger condom and it does prevent STI/HIV transmission. How does it do so? When you are having digital manual sex, you might insert maybe into a vagina, maybe into a rectum. But what happens is that bodily fluids, what we know to transmit HIV, bodily fluids can get caught under the nail. Well, let's say you go from vaginal insertion to rectal insertion to vaginal insertion, back and forth, back and forth. However you like to have sex, again, we don't judge. But if one person has an STI vaginally and they insert vaginal, a finger, and then they insert into another person rectally, for example, syphilis, this person couldn't contract syphilis or any other STI from the transference. So this is why finger condoms are so important. If you don't have a finger condom, you can simply use a glove. Make sure you use lube. So lube is the special mention. Okay, why Sierra, why Jacques Initiative, why are we talking about lube right here, right now, when we are discussing the barrier methods? Well, lube is not exactly a barrier method, but it is very useful in preventing HIV and other STI infections. Why is this? So, when you are having sex vaginally or anally, there's constant friction. Okay, sometimes there is no personal lubrication. Sometimes there is some, but there's very little. And what happens is the constant back and forth, the constant friction, it might cause micro tears, or simply it just might cause tears, which increases your risk of STI and or HIV transmission. Lube, voila, would help that. It would decrease the amount of friction and therefore decrease the possibility of you transmitting the virus. Not only should you use lube on the outside of a condom, what many people don't know is you want to use just a dab inside of an external condom. Why do you use lube on the inside of an external condom? I've never heard of that. This sounds crazy. Well, the reason why you do this is number one, and I say this, number one, is because it increases your sexual pleasure. Okay, that is the most important. This is most important because we know that a lot of people do not use condoms because condoms get in the way and it decreases the pleasure. A lot of people will say that they don't like to use condoms because they can't feel anything. But if you use a small dab of lubrication inside of the external condom, that actually increases the pleasure and it actually increases what a person can feel. So those are two reasons why I really stress to use lube. Okay. And so now we're going to get into HIV screening and why this is used to prevent HIV. Okay, Jarrell?
Preventing HIV, we usually use HIV testing. It's for anyone having sex, not just people who are having sex with multiple partners. It's used for people who are intimate with just one partner as well, because a lot of times you don't know what that other person is doing outside of you. And it's not about you not trusting that person. It's just about you protecting yourself and making sure that you're okay. The methods that we normally use as far as the rapid test is either mouth swabs or finger sticks. And it usually comes, well, it always comes back the same day, and it only takes about 20 minutes for you to get your results after being tested.
I want to add that you can get a rapid test from a local program like the Jacques Initiative, a community-based organization, but you can also get an HIV test from your physician. Please ask for an HIV test. If you don't want anybody to know, you can do one of those things. Or additionally, you can actually buy. They're very expensive though. I wouldn't suggest that. There are multiple ways to go online and to have a kit ordered to you, but you can also get an at-home HIV testing kit.
Can I also add, those people who are going to their primary care doctors, just because you get checked up every 3 months, every 6 months, doesn't necessarily mean that they're giving you an HIV test. You would have to ask, they need your permission to give you an HIV test, even if it's your primary care doctor. So just take a little note, just because you go to your primary care doctor, you go regularly, doesn't mean that they're testing you for HIV or STIs, because they have to get your permission to give you that. So take advantage of that and make sure that you have everything that you need. And you can also ask your doctor, did you give me an HIV test? Can I have an STI? Can I have some STI screening? Make sure you ask them that. If you don't want to come and see someone like me, Sierra, or Jarrell, you can always ask your primary care doctor to make sure that they're giving an HIV test, because they're not going to give it to you just because you're getting a checkup. It doesn't come along with everything else you're getting checked up for. Just remember that.
And I want to add on a little bit, because as community health workers, we come across this all the time. A lot of people are afraid to come to us versus their doctor. Okay, so people will not go to their physician to get an HIV test because they don't want to get stuck. That's the #1 fear. We hear it all the time. Are there needles involved? Well, if you go to get rapid HIV testing, unless you're getting hepatitis C testing, you do not have to get stuck. It is like Jarrell said, it is a simple mouth swab. Okay, I just wanted to stress the no needles. Okay, so now we're move into the stigmas and the myths. These are the things that we hear people are saying. These are the things that we hear people are thinking. We are out in the community a lot of the time. We meet a lot of community members, and there are a lot of rumors going around, a lot of stories going around. And oftentimes we hear the same ones, but every now and again, there's something that might surprise us. But we would like to go over a lot of these, a lot of things that are being said and heard and thought. All right, so we have an agreement to be exclusive. So I can't tell you the number of times that Rhonda, Jarrell, and I are at a table, at a health fair, out in the community, on the van, and we're asking people, hi, do you want to get tested for HIV? And someone will say, oh no, we're monogamous. They're not cheap. Oh, I only have one partner. He only has one, well, he better have only one partner. Or he'll say, oh, she better have only one partner. But what we want to say is, just because you're exclusive does not mean that you should not get HIV testing. Additionally, just because your partner has been tested for HIV does not mean that you should not get screened for HIV that has also happened a number of times. We will have a couple approach us and we'll say, hi, would you like to get screened for HIV? One person will say yes. The other partner will say, oh no, if theirs comes back negative, then I'm fine. And we know that's not the case. There have been instances where we will screen one person for HIV and they have been newly diagnosed or newly positive, and we then screen their partner or partners, and their partner or partners are HIV negative. So just because your partner, your spouse, your playmates has screened HIV negative does not mean that you should not also get your own screening. All right, anyone want to take this one?
Okay, so anal sex prevents pregnancy and STIs. That is a myth, okay? Anal sex does prevent pregnancy, and that's about it. It is a very high in HIV, it's a very high risk factor in HIV because the anus, the rectum, was not really necessarily designed for sex. And also, when you're having sex, it stretches the tissue inside of your rectum, which 9 times out of 10, depending on how big the person is, that it can have rips, abrasions, and everything inside there, which will make your rectum bleed. And if in fact that you're not using that good old lubrication, if you're using Vaseline, if you're using baby oil
Oh
gel,
gosh, no.
if you're using any of those things, anything that's not a lubricant, which is water-based or silicone-based, meant for sex, this puts you at risk for getting HIV, STIs. It does not prevent either one of those things. So just because you're having anal sex does not mean that you're fine, that you're great, that you're not going to catch HIV. Actually, you're at risk, higher risk of getting HIV and STIs because, like I said before, you're ripping tissue. You know, it's a hole that's not necessarily meant for sex, but it's pleasurable, honey. Let me let you know, it is pleasurable. But you have to be safe with everything you do. So if in fact you are interested or you're having anal sex, make sure that you use protection. Make sure that you use lubricant. So therefore it can make it as easy as a glide as possible. And we do have some lubrication over here that's called Glide. I was trying to find it as I was talking to you, but I can't find it. But make sure that you have those things. That's just to touch up on that. So remember, anal sex is high risk for getting HIV and STIs. Once again, reason being is because you can get all types of, you will get all types of cuts, abrasions inside of you that you may not be able to see, but it will have blood, and blood to blood will give you HIV. We do know that. We said that in one of our past slides. So remember that.
I also would like to add here, because some people are not aware, that you can contract STIs anally. It's not only vaginally, it's not only penile, okay? One other thing I want to say about that, because I did hear this at a table, or I just hear this around. The fact that you can get STIs rectally or even vaginally, a lot of people still do not want to use condoms, and they'll say, well, I can just go to the doctor. I can just get a prescription for my chlamydia. I can just get a prescription. Yes, you can. However, I like to add, and I try not to scare people, but this is a fact, okay? The more STIs you have, whether vaginally, whether rectally, even in your throat, it increases the chance that you could have maybe throat cancer, rectal cancer, or any type of cancer. It just increases your chance. So don't abuse the antibiotics that physicians are prescribing you. You still want to make sure that you are protecting yourself while having fun. While enjoying, having pleasure, having pleasurable sex, you still want to make sure it's very important that you are protecting yourself.
Also, remember, if you are having anal sex and things like that, and any type of STI is putting you at more risk for getting HIV because your immune system is suppressed, which means that it's easier for you to get HIV if you're already dealing with chlamydia, syphilis, or any other STI. So remember that as well. Keep that as a key point. Just because you contracted with an STI and not HIV, and you want to still do your due diligence, that means that you are at risk, higher risk of getting HIV because your immune system is already suppressed, which makes it easier for HIV to just slide on up in there. Okay, remember that.
Jarrell?
I am HIV positive. I'm not desirable. I can't date. We all know with new technologies coming out that everybody who is HIV positive should be striving to be undetectable. So that really prevents you a lot from not passing HIV to anybody else. So, and people who are HIV positive are living longer lives nowadays. So it's not gonna be a hindrance like it once was from you having relationships with people. Just go out and live your life now. Just take your meds, go see your doctor, and live your life, because that's what we're put on this earth for.
Yes, break out the wine glasses. Let me know where the next best restaurant is. I'm ready to go. Okay. I'll never eat behind or kiss someone with HIV. We hear this all the time. But we know, as we said before, the bodily fluids that put you at risk for contracting HIV are blood, semen, rectal fluid, vaginal fluid, and breast milk. Did we say saliva? No, we did not. It is okay to kiss someone with HIV. It is okay to eat behind someone who is HIV positive. You do not have to bleach your entire kitchen. You do not have to bleach all of your silverware. You don't have to throw away your plates and your bowls and things. It will be fine. Okay, this is a myth.
9 times out of 10, sweetheart, you probably already didn't kiss someone with HIV, and you probably already ate behind somebody with HIV. Remember, HIV doesn't have a look. It doesn't have, you can't tell nowadays, is the person not going to be looking black? They're not going to be skinny, so keep that in mind.
I just want to hit to the next slide, Rhonda. You were getting into it. But yeah, you can't tell by just looking at someone that they are HIV positive, okay? Before we move on, I kind of want to I want to go back. Another thing that we hear often is that if I go to a public restroom, I could contract HIV, I can get HIV. That is a myth. What would have to happen in order for you to contract HIV on a public restroom toilet? Okay, there would have to be a person waiting outside of the stall with a person who is HIV positive in the stall. They will have to actively cut themselves, place the blood on the toilet. The next person will have to come in immediately and cut themselves and then sit on that same toilet in order to contract HIV in a public restaurant. That's the way you could do it. Otherwise, other than being unhygienic, I wouldn't necessarily sit on the toilet unless there was some reason why. But that is a myth. You cannot contract HIV by sitting on a public restroom toilet. Now, here we go. Back to, you will not be able to look at a person to tell that they have HIV. So no, not only African Americans are positive with HIV. You cannot look at someone and say they're Black, they most likely have HIV. Not only LGBTQ, you can't look at someone and say, hey, I see the rainbow flag, most likely they are HIV positive. Not only the poor are HIV positive. You cannot look at someone's house and say, hey, this is not the rich area, this is not the rich neighborhood. I just know they are HIV positive. Literally, you do not know what a person who is HIV positive looks like.
And also I want to add, just because someone is a sex worker, because we do have our sex workers out here. Just because they're a sex worker doesn't mean they have HIV. If you really want to get technical, most sex workers are more careful than other people who are having casual sex. Reason being is because they know they're having sex with multiple people. And 9 times out of 10, in their purse, they have multiple condoms and lubrication to make sure that they're safe. So don't judge a book by its cover, people.
And use PrEP.
And use PrEP as well.
Actually, we're going to go, okay, in 2 slides. I'll save that in 2 slides, And that's one. Hey, Jarrell?
This one is, I have HIV and I'm dirty. A lot of times in the community, when we're doing testing, a lot of times people will come up to us and feel like and let us know that they have they're HIV positive, but they feel dirty, they feel ashamed of it. And I feel like in this day and age, you don't have to be ashamed to have HIV anymore, because people are thriving and living with HIV. But that stigma still goes around, and it's not just from them, it's people who are negative that's making them feel that way as well. And we want to put an end to this stigma, because it shouldn't be that way. This isn't something that people asked for. This isn't something that somebody wanted. It's just something that happened to them. So let's try to be more mindful of the things we say to people or how we make them feel just because they're positive.
Also, it's not a punishment. No, you did not contract HIV because you sinned or you did something bad. It is not bad karma. For example, anyone can contract HIV.
Hopefully with these slides and us giving you the education, that you'll be more educated, and hopefully you'll be more educated on this and you can treat people different. Reason I'm saying is because by me doing this type of work, I've run into many different people, and I'm going to talk about one case in particular. Of course, no names will be involved because they are protected by HIPAA. But I did have a client to come to me and definitely exposed to me that because she had HIV, that she felt dirty. She said that she takes multiple showers, and regardless of how many multiple showers that she takes, that she feels dirty. So the part in me, the human in me, I reached out and I gave her the biggest hug and told her, baby, you are going to be okay. Just have compassion with people, because you never know what they're going through. And this is the reason why we do this work, to educate people, because there are people living out there with HIV who are dealing with their own demons that they already have, that they have their own type of stuff that they're dealing with because they're positive. And I would hate for anybody to feel like they're ostracized because of what they're dealing with. I hate that. So I make sure that I do my due diligence in the community. If someone, expresses to me that they're HIV positive and they say that I feel dirty, my next move is to open up these arms, give them a hug, and tell them that someone loves them and you're going to be good.
Thank you, Rhonda.
You're welcome. Sweet.
Nice. This is a big one.
So let's talk about
LGBTQ.
PrEP again. PrEP is not only for LGBTQ people, like I expressed before. PrEP is definitely for anyone who is at risk of getting HIV. It is for people who are feeling like they maybe not at risk for HIV, but they know that they do a little, sometimes they may do a little cut up, you know what I'm saying? So they will take this medication just to make them feel a little bit more safer, you know what I mean? Like I said before, it cannot keep you from getting any STIs, but it will prevent you from getting HIV. Remember, like I said before, if you are having anal sex, anyone who's having anal sex, that you can take this medication for like 7 days consecutively. After that 7th day, then you can get your life and, you can do your due diligence and you won't contract HIV. For cisgender people or women who have, or people who have vaginas, you would have to take it for a little bit more longer, like 28 days. I'm gonna say 28 days to make sure you're safe. 28 days of taking a medication for you to, for it to actively work. It effective rate is 98 to 99%. It's better than not having no protection and no type of nothing. So I would say PrEP is a great thing. I would also say that PrEP is not something that you would be able to take that I would suggest that you take for the rest of your life. If you stop having sex, if you stop, you get in a monogamous relationship with someone, you both get tested, you both find out that you're negative, and you both vow to each other, if you step outside the relationship, we're going to use condoms with anybody else other than us, then you can get off of PrEP. If you get married, you can get off of PrEP. Whenever you feel comfortable with getting off of PrEP, then you can get off PrEP. But let's say summer comes back around, you're single again, back on the prowl, you can get back on it. You can get off and get on it as much as you like, as much as you feel as though that you're at risk for getting HIV. But remember, each and every time that you get off and come back on, you got to restart those days again. 7 days for anal sex, at least 28 days for vaginal sex. But it's for everybody.
Also, it's important, I don't think we stressed this in the last slide, that when you are taking PrEP, you do still need to have regular HIV testing. They usually say every 3 months to get regular HIV testing. And this is really important for you as an individual and everyday regular schmegular person to know. Why is that? Why do I need to know this? I'm not a pharmacist. I'm not a doctor. I'm not a physician. My doctor will take care of all of that. No. We have had instances where community members have come to us wanting PrEP. And the doctor told them no. The doctor said no because this reason right here, PrEP is only for LGBTQ. Okay, so this person called us, we connected the doctor to the physicians that we know, and the physician educated our client's physician. And so this is why it's important and very empowering for you to know and to have this information for yourself, because physicians are not omnipresent. They don't know everything. They aren't everywhere. Sometimes you get information before they have information. And if you're watching this, you have this information that possibly your physician does not have. PrEP is for everyone. It is for women. It is for men. It is for non-binary. It's for everyone. Do we have any questions in the chat? No. Okay, I was hoping we would have more discussion, but that is all right.
I do have some questions for y'all.
Yes.
Yeah. I didn't realize y'all were at the end of the presentation until you moved the slide, but I was just writing down some questions I had as I went along because I didn't want to interrupt you.
Sure.
The first one I have is about PrEP and PEP, and then also the testing you do. So are there options for people to get PrEP or PEP if they do not have health insurance? Or are there resources that you guys as the Jacques Initiative offer to people who don't have health insurance?
Well, if you don't have health insurance, we do have different things. We're about to have a webinar on the access of PrEP and making sure that people who want to access PrEP can get on PrEP. Also, we do refer outward. We do refer out to BCHD as well, and they do have a program where they do have a program where it's funded for people who want to get on PrEP, so they can see their doctor and they can get on PrEP and get the medication without a big copay or having to pay for their medication. So there is things that we do have. If you want to come and see us, all of our numbers is at the bottom. If anybody would like to call us and help us out, will call us and they want our help. They want to get on PrEP. They want to access PrEP. We do have ways that we can get you on PrEP without having insurance, but it's also a part of our job if you don't have insurance to extend that you can get on insurance with Medicaid, Medicare. So we do have different ways of doing that as well.
And BCHD stands for Baltimore City Health Department.
Oh no, did I just?
Thank you. Yes, because just want to make sure that folks knew that. For those who may not know what BHCD represents.
BCHD, Baltimore City Health Department. I'm sorry.
Right.
Awesome. Thank you for that. Another question I have, I know you touched on this kind of briefly going in the stigma and myths, but what are just some of the best ways that you can be supportive if a loved one shares with you that they are HIV positive?
You just want to be there. This is kind of a difficult situation because not everyone reacts the same. So it depends on the personality of that person, but you want to be there, you want to support them, you want to let them know that this is not a punishment, that it is okay, that there is treatment, that it doesn't mean that they have to die, it doesn't mean that they have to live in shame. They can get help immediately.
And also for those people that you know that's HIV positive and having a hard time, once again, you can contact us. We do have support groups for people who are HIV positive. We have people who have been living well with HIV for over 20 something years that's in these support groups, that run the support groups and things like that, that can help them with their stories. A lot of time with people, they need to see something, see someone who has been living and been thriving with HIV for them to feel a little bit better, that they can visually see that life goes on after HIV. So the best thing that you could do, if you have nothing in your power, you can only say what's in your heart. You can only help them with so much, but you can call those numbers that was at the bottom. You can get in contact with any of us and we can link them to different, I'm sorry, I didn't got a break.
Supportive services.
Supportive services, yeah, support groups and things like that can help them along with it. Like I said, they'll meet people who are living with HIV, thriving with HIV, and still moving on. So I think that the best thing for people, what I have noticed and what I have learned over the years of doing this work, is actually showing them someone who is thriving, because you telling them is not going to register. You showing them someone who's living and thriving with HIV and who is undetectable. You can't tell. They're doing their due diligence in the world. They're making changes. They're making moves. That will be the best thing that you could do for that person.
An everyday person as well, because sometimes we do hear like, oh, well, not Shaq, well, Magic Johnson. And then the first thing that says, oh, well, he has the money to live the way that he does. When no, there are people, literally, you have come across people. These are everyday people, not only children, with grandchildren, okay, who are living and thriving. We do tell people that, but yes, I do agree with that, Rhonda. Showing them is better than telling them. And I just wanted to go back. I'm sorry, I think I put this on the shared screen. I didn't mean to. But PrEP is available through Medicaid if someone does not have their own private insurance.
Awesome. Thank you so much for answering my questions. Tony, did you have any?
Yeah, so I know you all have so many awesome resources for the community. I'm so grateful for that. If we wanted to tell someone to reach out to contact you, I know you had some of your numbers posted on that last slide. What would be the best way for folks to reach you? And then also, do you provide services in other languages?
Currently, we provide, we have interpreters. We have interpreters. Our own director of community outreach speaks Spanish. We have clinicians, social workers, and I think not a physician, but I think one of our nurse practitioners is Spanish speaking.
And also at the clinic that we'll send you to, if it's a language barrier, they will ask if they need an interpreter. So the clinic that we'll send you to, they do have interpreters as well that they can help with the language barrier if that is the case.
And another question I had is, sometimes individuals may be in the Baltimore area because we're the college town, right? And so we bring in folks from all over the world on F1 and J1 visas, and students studying abroad who may not have access to insurance based off of that. Do you have services that support international individuals who are here visiting the city to study?
So for
yeah.
go ahead.
I would say yes, for as far as I know. I know a lot of times with the PEP situation, like I said, I get emails from Mercy, and not everybody lives in Baltimore. Some people are college students who are from Minnesota, wherever they're from. And they still get linked and get services from that we can refer them to. That if they're in Baltimore City and they may not be from here, they can still get referred out and
Yeah.
get services.
We've also had community members move out of Baltimore at the drop of a dime, and what we have done is work with their new residential local health department and making sure that they continue their treatment and or get services.
Well, thank you all so very much for sharing this valuable information. I mean, I learned a lot today too. And so, what you're doing for the community is wonderful. And we're really lucky and fortunate to be able to have you come and speak with us today. For those students who are watching this at home, if you are looking for the direct link to the Jacques Initiative's website, you can find it on the Office of Student Support's website. It's in our navigation bar on the left. You can also reach out to our office and we can share the information to you. And then if you want to go straight to the Jacques Initiative and cut out the middle person, again, what would you all recommend folks do? Just look up the website, or what's the best phone number to call?
Yes, I'm trying. Give me 1 second. I'm sorry.
I would pop that up on y'all without preference, so.
It's okay. My screen. Hold on. I wanted to share. Okay, so individually, Rhonda's number is, you can contact Rhonda at 44. Do you know it by heart? I didn't know.
Yeah, 443-827-7605.
Okay, and this is call and or text. You can text, please. We know that a lot of people do not like to talk on the phone. Okay, this is a new age. Everybody likes to text. You can also reach me at 443-827-2879.
And you can also reach me at 443-827-1581.
Additionally, again, because not everybody has phones and not everybody has reliable service, we have been messaged on Instagram and Facebook. If you don't have a phone, if you're using a friend's phone and you don't have your own personal number, we do respond to the DMs, okay? It goes down.
Sounds wonderful. Before we close out, is there any last messages that you would want to share out to the student community here at the University of Baltimore?
I want to share that this is not meant to scare anyone. This is just so that you can live your best sexual life, and so that you can be empowered, you have all the knowledge to know what you, things that you need to protect yourself. Do not leave it up to anyone else. Do not leave things up to your physician to tell you. Do not leave things up to a partner or a playmate to tell you. Please protect yourself. Don't be afraid, and enjoy.
Awesome. Well, on behalf of the Office of Student Support, we are so grateful. Thank you so much. And again, you've got the contact numbers, you've got our information, so please don't hesitate to reach out either to us or to the Jacques Initiative directly. Thank you.